Okay, good evening and welcome to this week's Chai Chat. We've been off the air for just a couple of weeks or so, but we're back on again. A number of you are watching on the live stream on our YouTube. Some of you have come onto the Zoom meeting. Welcome to all of you. I hope you've all got your chais with you and that you are ensuring that you keep your blood sugar levels as low as possible. I'm very pleased and delighted that we have a very special guest at Chai Chat this week. He was actually on a few years ago, but he's rejoined us. He's moved around some patients to be with us, so we're very pleased to see him here today. And that is Dr. Siva Sivapuriam, who is a consultant at Maidstone and Tunbridge Wells Hospital. Is also an honorary senior lecturer at King's College London. He is the clinical lead for the department, is the college tutor and involved actively in medical education, including the local medical school development. He also has a passion for clinical teaching and the quality improvement project led for the medical students, lead the medical students at King's College Hospital. He provides comprehensive care in all aspects of diabetes and endocrinology, and he's written widely on this subject. So those of you who are on the Zoom, I know have indicated that you want to ask questions. The rest are going to be watching us as we live stream on YouTube. So a big welcome to you, Dr. Sivapuriam. Thank you for joining us. The floor is yours for about 10 to 15 minutes.
Thank you, Keith.
So I'm able to put your yellow hat on to speak. The floor is yours.
Thank you, Keith. I'm going to share my slides, if that's okay. Just give me 1 second. Hopefully you guys can see the slides as well. Can you see the slides as well, hopefully?
Yes, we can see.
We can see the slides. We can see the slides.
Perfect. So good evening, everybody. And it's really a great honor to come back again. So good evening, everybody. And it's a great honor to come back again and talk to you guys about the diabetes. And last time when I was here, I was talking more about, cardiovascular issues related to diabetes and also thyroid issues related to diabetes. This time, I am here to talk about how to prevent complications related to diabetes. And if I could move to the second slide.
We're having difficulties hearing you, Doctor. Dr. Siva?
Can you hear me? Sorry, can you hear me, by the way?
Yes, we can hear you now.
That's much better. Yes, we can hear you now.
Okay, so what I was listed here is about explaining different important side effects related to diabetes. There are 3 important microvascular complications related to diabetes, and these are nerve damage, so people call it neuropathy. These are kidney damage, it's called nephropathy. These are related to the eye damage, which is called retinopathy. There are 3 major blood vessel related complications related to diabetes. One is heart disease, another one is stroke, and peripheral vascular disease. So these are the complications that we can prevent together. It is also important to recognize and often under discussed in the clinical appointment and also even like by the patients and even healthcare professionals about other important side effects like erectile dysfunction. And also, I think we will have to agree, given that diabetes is a long-term condition, a lot of people also have mental health effects related to diabetes. So that's really important for us to discuss through. If I just go to the if I go through the important ABCD way of going through the diabetes, these are the important aspect of diabetes everybody should be getting whenever they are seeing a healthcare professional. And I have tried to list this as A, B, C, D, E up to L. And obviously, it may not be relevant to everybody, each and every aspect of this, but it is important that we will have some understanding about what should be offered to any diabetes patients, whether you are diabetic or whether one of your family members goes to see a healthcare professional in relation to diabetes. These are the kind of important aspects they need to go through. If I just quickly run through important bits, advice is importantly talking about smoking cessation. And we will have to agree smoking cessation is very important. And we can also add another one importantly in that one, especially now more commonly being emerging problem is about sitting down and desk job and working from home and, related to sedentary aspects of it. So that's, again, exercise is important, and whoever is working from home need to have some kind of ways of doing exercise. So that's important. The second thing I will probably highlight is to screen for two important complications related to diabetes. Number one is fatty liver. So that is about deposition of the fat in the liver. And it seems to be the commonest cause of liver failure going to be in the future. And unfortunately, the diabetes patients are more likely to get this, and they will need to be screened for this. So we will need to make sure at least once you have a blood test done for liver test, and also review your previous investigation you would have had for any other health reasons, including the scans to look for any fatty liver. The last one is sleep apnea. Sleep apnea is more common in people with weight problems, and in fact, even more common in people with weight problem and diabetes. Sleep apnea, it's actually an important condition to recognize because they can improve the quality of life, improve the sleep, and it also make patients to feel better from their energy well-being point of view. It's fairly easy to screen for sleep apnea. So the scoring we use is something called Epworth scoring system. And I do actually ask the patients to check for sleep apnea, especially if they snore in the night and also have any family member witnessing them having apneic episodes, which we call like breathing or stopping the breathing episodes. The next one is blood pressure control. It's very, very important to make sure the blood pressure control is discussed. I got a slide for that one in a second, so we will talk about that. Cholesterol is important. Nowadays, we have definitely better treatment available for cholesterol management, not necessarily only the statins. We have better injections available, and it's pretty much standard offered in the NHS as well through NHS England funding for even expensive treatment. And it is very, very important for us to make sure that we do have a blood test done for cholesterol check for our diabetes patient. The diabetes control itself is important. And I have put the ideal HbA1c in percentages, less than 6.5%, or in millimole, 45 to 55 millimoles. The eye care is important, so everybody should have eye test done once a year. Feet check is important, so self-inspection of the feet and also asking the healthcare professionals to check the sensation of the feet. And medications, including other drugs like statins we talked about for cholesterol management, and looking for any other pre-existing heart problems and screening for heart problems and asking patients whether they have any chest pain or any history of angina is important. Injection sites, if they are already on insulin, need to be inspected on a regular basis because that can be a problem for patients not getting their diabetes under control. If anybody is planning for pregnancy, very importantly, they need to have the HbA1c to the best level. Often, most of the places, we have services available for preconception counseling, and that need to be offered for the patients. One of the things we don't actually do very well is actually screening for kidney disease. The simplest screening test for the kidney disease is a urine test, where patients have their urine samples sent for checking protein in the lab. It's not the urine dipstick we do in the clinic, and that need to be checked at least once a year. Patients with diabetes should be encouraged to engage with activities like sports, driving, and even if they want to, enjoy social life like drinking alcohol, they may well want to discuss about that. So hopefully this screen shot or this slide helps you to understand the important aspects of diabetes we need to be going through. And the main point about that one on this slide is, if I pick up the important one that will prevent further, diabetes-related problem or heart problem related to diabetes, is controlling the blood pressure, controlling the cholesterol, and controlling the diabetes. These three seems to be the most important aspects of us preventing any damage related to diabetes. So now we talk about body mass index. We have to appreciate, being Asians, a lot of people ourselves on the audience here, BMI is not a really good marker of reflecting the weight problem. So we will have to understand that. And often most of the guidelines advise us to add 2.5 to the BMI. So even though our BMI may well be within the normal range, it may not truly reflect the likelihood of getting, heart-related problem or even diabetes risk. So that's important. But importantly, equally, any weight we started with and losing more weight will sensitize the insulin and will help the insulin to work more effectively. So that need to be really part and parcel of the conversation. And exercise should be 150 minutes per week, and smoking, I think I already mentioned that. And contraception discussion for young ladies who is planning for pregnancy and also need to get their control, better from that point of view. So this is a slide help us to tell the benefits of weight loss. The best time to do the weight loss is the early part of the diabetes, so in the initial phases of diabetes diagnosis. If you are able to lose about 10 to 20% of the weight at the point of the diagnosis, you're likely to reverse the diabetes and you're likely to cure the diabetes. And that's really crucial. And I think it's a really important message I would like to give you for audience. Anybody who is diagnosed with diabetes at the earliest point, that's the best time to get the best buck for money kind of thing with the weight loss. But we do also need to recognize in UK, we have different weight management services available. And I think we'll probably talk about some of the medications as well, during the discussion perhaps. One of the medication we have is called semaglutide, which is also called Wegovy for the weight loss purposes. They're very helpful adjunct for patients to lose weight and reverse the metabolic complications related to weight problems, including diabetes, and also high blood pressure, fatty liver, and sleep apnea I mentioned before. So it is really important to make sure you know where your weight is and you discuss about how best to lose the weight, and ask your healthcare professionals to help you with the options available for weight loss, including relevant referral to the services available locally. So I did already tell you about the blood pressure control. The blood pressure control is key here. So blood pressure control point of view, we will need to make sure that we control the blood pressure if you have diabetes to less than 140/90. And that need to be a minimum level of blood pressure control. If you actually have any organ damage like kidney problems or eye disease, your blood pressure control should be less than 130/80. So hopefully you have some understanding about where your blood pressure is if you have diabetes. The next one is the cholesterol control. So the cholesterol control point of view, it's important to recognize the cholesterol levels are checked on an annual basis at least. And the target cholesterol for total cholesterol should be less than 4, and the bad cholesterol, or the LDL cholesterol we call it, should be less than 2. I also worry about only people talking about diabetes control, which you see on the screen here. where people, when they go to the diabetes clinic appointment, only talk about the diabetes control. But that's one element of many different important conditions we need to address in a patient with diabetes, because the diabetes control only itself is not going to give you the best benefit you're looking for. That's where the cholesterol control and also the blood pressure control is key as well. So the other thing I would like to mention is two important medications. One of them is this one here, SGLT2 inhibitors. These are drugs that excrete and get rid of the sugars through the kidneys, and by them getting rid of the sugars through the kidneys, they improve the diabetes, they improve the weight, and they also improve the blood pressure. But the other benefit they give, which is important benefit, is actually preventing any heart-related problems and also further kidney damage. If you have diabetes and if you have had a heart problem, if you have had a kidney problem, even like a protein leak in your kidneys, you should be on these medications. So it's almost a must, because that will prevent further damage to the heart, that will prevent further damage to the kidneys as well. So the second one that will be another important medications need to be given to you is this medication class called GLP-1 agonist. It's very popular because these drugs are used for weight management as well. And you got few names there you can see on the right side of the slide. But these drugs are called, the common one used is Wegovy or semaglutide. And Ozempic is another one, we use for diabetes. And we got another one called incretin called Mounjaro. So these are very powerful drugs. The way they work is they improve the insulin secretion, they sensitize the insulin, they slows down the food moving down the gut, means the food is only slowly released, and that helps patients to improve their diabetes. They also help with the weight. They also actually help with improving heart attack, and even some evidence to support some stroke related problems. So if I want to give you three important messages to all the audience here, the first one is to make sure that you find out whether you have fatty liver or sleep apnea. Please do screen for them and ask your doctor or healthcare professionals to help you with that one. The second important thing is to make sure that you look for these two important drugs I mentioned, SGLT2 inhibitors that works through the kidneys, and GLP-1 agonist, which is the drug also help with the weight problem. So if you end up taking one of these two drugs, they help with the weight problem and also diabetes, and also with controlling the blood pressure and the cholesterol. They're likely to help you preventing further damage to your body from diabetes and also other conditions related to weight problems. And I think I'm going to pause there because I would like the audience to ask any questions, because I'm sure there may be a lot of questions around these important points I mentioned. So I'm very happy to answer any question.
Thank you so much, Dr. Shiva. I hope you can hear me, because I'm overseas at the moment and the connection isn't very strong. So nod if you can actually hear what I'm saying. I hope you can. Very good. I sent you a little note about somebody who'd rung me yesterday about that particular injection that they say that they've been asked to take by their doctor for their diabetes. And they asked specifically the question of what is the side effects of having these injections.
Yeah.
Obviously, people don't want to do injections because it makes them kind of, addicted to an injection. What are the side? You'll have to tell everyone what the name of the product was. But what about that? What is the what is the side effects of having an injection of that kind?
So the injection that was asked about is injection called Ozempic. I think you see it on the slide here, midpoint there, Ozempic. It's a weekly injection given into the skin. I can confirm the audience, this is not insulin, by the way, because a lot of times when we hear the word injection in diabetes, we always think about insulin. So we're not talking about any insulin injection here. This is one of the drug has been used in the diabetes treatment, similar ones for the last 15 years. It has changed the way we manage the diabetes. And this is actually a hormone we produce within our gut. and it's called incretin hormone. The name comes from, they do increment the amount of insulin production in the gut. That's how the incretin name comes from. There are a few of them. One of them, I think, question was Ozempic. It's also called semaglutide. And they increase the amount of insulin production. They sensitize the insulin. They inhibit the production of anti-insulin hormone called glucagon. So that's how they work. Because they work in the gut, they can cause side effects because they alter the gut kind of hormones. The common side effects people describe with these drugs are related to nausea, feeling sick, diarrhea sometimes, and constipation. But the good news is nearly half of them don't get these side effects. But people who get these side effects also actually get used to the side effects. They do develop something called tolerance. The two important side effects I would like to highlight, it's important. The number one is pancreatitis. These drugs in a smaller percentage of patients, even in the studies they have conducted before, has been shown to cause pancreatitis. But it is very uncommon for us to worry about, for a day-to-day practice kind of thing. In my practice, I've been using similar drugs, with this class for the last 15 years, like I said. I have only seen like few patients of pancreatitis. So it's not really a big risk. The second is actually in some mouse studies, in mice studies, when they did the studies, they noted some kind of increased cell proliferation in the thyroid gland. So that's how we don't really give anybody this drug with a family history of thyroid cancer. So those are the two things. That particular type of thyroid cancer we're talking about is very rare. Obviously, as a clinician, as a doctor, my duty is to make sure the benefits of using this drug versus the side effects that come with it, because it is important to balance that judgment when we are thinking about these medications. The benefit I see my patients getting with these drugs is actually controlling their glucose, but also improving their weight problems, and that's how patients actually feel much better with their diabetes control and the weight management. So I can't avoid doing that, in the sense I will end up giving this, and most of the patients actually end up taking it. Of course, it is an injectable form of treatment. We do actually have a tablet version of semaglutide, same one, but they are less effective, and they are a little bit more likely to cause side effects with it. So that's what I think the preferred choice is, actually injections, to the point that this became very popular. And we have been instructed not to start anybody new on this at this point in time, because it is so popular, where it actually helps with the weight problem and also improve the diabetes. So I think
very quick response to that. How long should you carry on having side effects before you stop? You said that people get used to it, but how many weeks, if you have this injection, how many weeks should you carry on with side effects?
Yeah, so I would probably say about a week or two. So if it is not settling down within a couple of weeks' time, we will need to actually stop the medication. We can try other medications, like Mounjaro is another one, which is another injection as well. So obviously, there are two things. One is side effects. Some people had to really stop it after 2 weeks of trying it. The second thing is, obviously, injection is something people don't like to inject themselves, is another reason why people are reluctant to take these medications.
Wonderful. Are there any questions to the doctor? He needs to go away in about 6 minutes to see other patients. So anyone would like to ask a question, they just need to unmute and start speaking. Or if you don't know how to put is that hand up, Manju? Are you asking a question, or are you just waving? Any questions to Dr. Siva? Excellent. Well, you seem to have got away very lightly, Dr. Siva. You've carried everyone with you. So thank you very much for your presentation. And we know you're time limited, so you have to go off. We're very grateful to you for joining us. We've been off for about 4 weeks or so, but we're back again. And we're very glad that you were able to join us on our return to the Chai Chat. So thank you so much. I'm sure patients are knocking on your door. So we will let you get away. Thank you.
Thank you, Kit. Thank you for giving me the opportunity. Have a good day. Enjoy your holiday time. Take care.
Thanks. Let's go from Dr. Siva to Ankita, who is somewhere in Leicester and has the news headlines for us for this week. Ankita, are you there? Dr.
Yes,
Ankita?
I'm here.
Excellent.
I've got 3 headlines for you today. So the first one, the health benefits of apple cider vinegar. So apple cider vinegar is a mixture of apples and water which undergoes fermentation. So consuming just 1 to 2 tablespoons of this every day can help reduce cholesterol levels, blood sugar, reducing your BMI, and overall helping with weight loss. Headline number 2, free drink refills could be banned in Wales. So the Health Secretary in Wales has proposed a measure to restrict the promotion of food products high in fat, sugar, and salt. So this would involve stopping retailers such as Nando's, Subway from offering free refills of your drinks. So this pledge overall would support people to make more healthy decisions. And headline number 3, hospitals to use artificial intelligence. So as you're probably aware, artificial intelligence is starting to take over many industries, and it's starting to kind of merge into the healthcare sector. The AI will be used to speed up with patient care and reduce unnecessary lengthy admissions. So the software in place would help healthcare professionals with interpreting X-rays, interpreting blood results, which would overall help with admission times, reducing them immensely. So those were the 3 headlines for today.
Wonderful. Thank you so much, Ankita, Dr. Ankita, for joining us somewhere in Leicester, I think, from Rushmede. We're very grateful to you for joining us. We don't have tables of people walking, though I can tell you I'm walking around here on my holiday, and I have done, definitely, I'm going to win the league this week. I've done more steps than anyone else could possibly have walked because I've lost my way several times. Anyway, we are back weekly. We'll be back again next week at 6 o'clock, and we will let you know exactly who is coming to talk to us. So unless anyone has anything else to say, thank you very much for joining us for this week's Chai Chat, and we will see you again at 6 o'clock next Friday. See you then, and a very good evening.